Hi everyone, I am Dr. Anantapal. Today, as you see, the discussion is about the obesity. Obesity is a major health problem not only in India but also all over the world. And why I am going to discuss the obesity? Because there is some new definition and guideline is about the obesity is coming in the paper of Lancet. So we have coming with this new definition and the criteria. Along with the, I will discuss the whole of the overview of the obesity, starting from the risk factor, complication, what is the treatment, what is the medicine, what is the bariatric surgery going in very short and concise manner. That will helpful to your NEET PG and as well as the INICET examination. So stay with the end of the video to see the all the things which is required for the obesity. Now, what is the obesity? Obesity is nothing but too much body fat is known as obesity. Too much body fat is considered as a obesity. What is the causes of obesity? So obviously one of the major cause the excessive eating of fatty food. Second is lack of exercise. Some of the medicine can produce the obesity like antidepressant, steroid, beta blocker. Some genetical cause can produce the obesity. Now, is there any complication will be the occurs obesity? Obviously, we know that a lot of the complication will be the occurs due to the obesity. Major health problem will be the occurs like type 2 diabetes mellitus, obstructive sleep apnea, cardiovascular disease, fatty liver, gallstone, osteoarthritis. Now, how to measure the obesity? In previously, we can measure the obesity by the help of the BMI. What is the BMI? BMI is nothing but the body weight in kg and length meter the square. But why the new definition will be coming? Think about the athletics person who having the large body weight. That's why the BMI is high. But whereas the person who have actually the body fat is high but the weight is low, but the BMI is low. So there is a discrepancy between the BMI where the even the athletics is called the obese, but the normal fatty people is not the obese. That's why the new definition is coming that only the BMI is not a including factor of the obesity. Why? What are the including factor is associated with the BMI? That is the body size. Now, new definition of the obesity is whether the available of the body fat measurement we can directly measure the body fat. So whether availability is present, we can directly measure the body fat measurement, or BMI plus any one measurement of body size. So this is the new definition of actual obesity. Now what is the body size? We have to measure some of the value of body size. One is waist circumference. For male, reference is more than 102 centimeter. For female, reference is more than 88 centimeter. Waist hip ratio for male, the ratio is more than 0.9. For female, the ratio is more than 0.85. Third, waist height ratio for male or female, plus minus female, it is more than 0.5. If any one of this body size along with the BMI will be BMI criteria satisfy that obesity. Now we have to know what is the BMI value for obesity. According to the World Health Organization, the BMI values are less than 18.5 considered as underweight. Eighteen point five to 24.9 is a normal. 25 to 29.9 overweight. 30 or more than 30 considered as a obesity. Now, obesity also have three category: class 1, class 2, class 3. Class 1 obesity means BMI more than 30 to 34.9. Class 2 obesity means 35 BMI to 39.9. And class 3 obesity means BMI more than 40. Now one of the new things is coming, that is the new diagnostic criteria for the obesity. New diagnostic criteria define that there is a obesity is further divided into the two parts. One is clinical obesity, one is preclinical obesity. What is clinical obesity? Clinical obesity means patient having a chronic disease with some organ dysfunction due to obesity alone. Chronic disease with organ dysfunction due to obesity. Preclinical obesity means patient have various risks of healthcare issue but does not ongoing have illness. But no ongoing illness. That means patient having the high risks of diabetes mellitus, patient have the high risks of uh, liver disease, gallstone, obstructive sleep apnea, but still now no ongoing illness will be the present. That means preclinical obesity. Now we can discuss about the how to treat the obesity. The treatment part of the obesity. Prevention is always the better than the cure. So we have to prevent. How to prevent? By daily exercise, avoid of excessive fatty food intake, some of the medicine is available that can decrease the appetite followed by decrease the obesity. The most commonly medicine is GLP-1 analog, that is semaglutide, liraglutide, bupropion, naltrexone. Now when the medicine is not helpful, what to do? We have to go for surgery, and when we do the surgery for decrease the weight loss, the name of the surgery is pediatric surgery. Some of the name of bariatric surgery are duodenal switch surgery, gastric band surgery, Roux-en-Y surgery, and sleeve gastrectomy. So this is the overview all about requirement of the obesity, but mainly I can focus the new diagnostic criteria and the new definition, new diagnostic criteria and new definition of the obesity, and rest of the things is required for the coming the NEETPG and INICET examination. So I think this may be the helpful in your coming the examination. If you like this video, please subscribe and like my channel.